Would you rather choke down a handful of pills every day or jab yourself with a needle? Let's talk about it. If you've been diagnosed with an IBD such as ulcerative colitis, unfortunately these are probably your only two options. When I first got diagnosed with ulcerative colitis, I started out with a handful of pills every day. At one point I was taking upwards of 28 pills every day. And the funny thing is, some of those pills I was taking in order to combat the side effects of some of the other medications I was having to take for it. What? Unfortunately, this is the reality of taking lots of medication orally for an extended amount of time. Because anything that you take orally is going to have to be processed through your liver. And sometimes that can cause some long-term side effects. At one point, I was having to go and have blood work done every 4 to 6 weeks just so they could check on my liver. My bone density suffered because of all this medication I was taking. It's probably a really good idea for you to have this conversation with your doctor about any possible long-term side effects of you taking all these pills every day for an extended amount of time. Maybe there's something you can do now to combat that so that the symptoms or the long-term side effects won't be as prevalent. So I was taking this handful of pills every day for 20 plus years, and it was working great until it decided not to work anymore. So one day the doctor came in and said, "Have you ever thought about taking biologics?" You know, doc, back in school I never was all that great with biology, so no, biologics. Most biologics represent cutting-edge biomedical technology. I'm not going to go into the details of the biologics and how they're produced and all that. Bottom line is IBDs or ulcerative colitis, biologics represent injections. They're medications that you inject into yourself. At this point, I was pretty desperate. I was willing to try anything because my symptoms were so severe. I'd even brave the needles. Doctor started me on this biologic treatment, Humira, which was a self-injection I had to do every 2 weeks. At first it did okay. After about 3 or 4 months it stopped working, so I got on another biologic medication called Stelara, and that's 1 injection every 2 months. Now that seems to be working much better. Keep my fingers crossed on that one. The best thing about the biologics for me personally is the fact I don't have to take that handful of pills every day now. I don't have to take anything. The only prescription I'm on is that biologic medication, which is great because in the morning I don't have to worry about having to go through my prescription bottles and measuring everything out and taking all those pills. It's just 1 injection that I take once every 2 months, which is so much more convenient, even if it is a needle. Of course, it's got some side effects as well. One of the biggest things is the fact that it suppresses your immune system. With a suppressed immune system, of course, you're more susceptible to getting sick and having viruses and stuff like that. And when you do get sick, it may be harder to fight those things off. So that's one thing to keep in mind. I haven't really experienced a lot of that since I've been on it. Of course, I haven't been on it that long, only about 6 months. But I tell you, having to go without taking those pills is a huge benefit. If you're interested in how the injection process works, be sure to check out this video right here where you get to see me jab myself. Thanks so much for watching. I really appreciate it. Don't forget to like, comment, subscribe, help this channel grow. Until next time, I'll see you soon.